let's talk about heat. That almost sounds like a pop song, but let's talk a bit about the climate crisis. It's not hitting people in the same society in the same way, let alone within a country or within regions. So what makes the climate crisis a health crisis, if we want to start with a very big picture view?
Sure, I could start for a perspective from a state perspective from Arizona. You know, I think it is a public health crisis. I think we heard Secretary Becerra say that on a visit to Arizona when we talked about some of the impacts and initiatives and efforts that we're doing within our state to mitigate heat. And when you really think about it, we saw in 2023 over 990 heat-related deaths in our state. And that is an exceptional, unprecedented number that we saw in 2023. And when you look at that breakdown of the ages and also the impacts that we have, a lot of people may think that it's visitors coming down to our state who may not be able to acclimate to the heat and some of those other pieces, but we're seeing it amongst our community members. I believe we had just about 70% of those heat-related deaths were among Arizonans that lived in our state for 20 or more years. So that really shows it's hitting our state's population. And when you look at some of the driving factors among those socially vulnerable populations, such as substance use disorder, homelessness, you could either be living in urban heat islands or in rural areas, and looking at tribal communities and some of the disadvantages and social impacts that they're dealing with. It really is a community-wide urban, rural, and tribal concern within the state of Arizona.
Yeah, and I'll just add, you know, in addition to my federal role, my background is as a primary care pediatrician. I practiced for many, many years in Cleveland, Ohio. And we were talking about before we came up here, there's no region that really is unaffected right now by the health impacts of climate change. So speaking as a pediatrician in the upper Midwest, we're experiencing changes in air quality that can be challenging for kids with asthma, changes in allergy seasons. They're longer and more intense, especially in northern latitudes, a double whammy for some of my kids with asthma. Effects to water quality, as we've seen toxic algal blooms in the Great Lakes as a result of warming and runoff. And then extreme heat affecting regions, including in the northern latitudes, that are not acclimated. I mean, it's a challenge in the Southwest, but it's also a challenge in the northern latitudes. I'm finding, you know, myself counseling my fall athletes about heat protection. That was not an issue 20 years ago for a football player in October in Cleveland. So a lot of local impacts that we're seeing in the upper Midwest. And then nationally, in addition to those issues I just raised, there are changing patterns of infectious disease, including vector-borne diseases like Lyme disease, mosquito-borne illnesses, as well as really mental health impacts, both in the aftermath of these extreme weather events, but also for our young people who are witnessing a changing world and are going to experience climate-related disasters and extreme weather events that their parents and grandparents did not look forward to. So it's really, there are both acute and chronic long-ranging impacts, and as you said, with disproportionate impacts on people who are facing already systemic disparities and physiologic disparities as well, children being disproportionately affected by climate-related health issues.
Yeah, I remember in February I got bit by a mosquito in New York where I live, and I was like, oh, this is not a good sign. Mosquitoes never bring good things, but in February, I mean, I was like, polar vortex now, please, zap them out. So Phoenix, your beautiful state's biggest city, just had 14 days of record heat in a row. As the kids would say, it's hot AF there. But it's October. So from your perch, though, you know, a lot of people, there's a lot of evidence, something's going on with the climate. Some people, you know, don't think that we're seeing climate change, but how do you counter that kind of narrative? You have to get things done. And so if people are saying, it's always been hot in Arizona, how do you manage to get your work done with some pushback on that front?
It's funny you say that about heat, because my son, he's a sophomore playing football and doing football practice, and he says that to me about every day. So, you know, starting in June when they're out there practicing. And, you know, I think when we talk to individuals and make sure that it is a point of importance, we let everybody know that everybody is at risk for heat-related illness. You do not have to be in a specific vulnerable population to have a risk when it comes to. It could be an impromptu decision to go for a hike on a warm day that you weren't planning and you didn't bring enough water with you. It could be an unexpected automobile breakdown that happens on the highway and you're unprepared, along with individuals who have multiple compounding risk factors such as substance use disorder or mental health care needs or other items that could be coming to the table. And I think when we talk in our state, we really talk for extreme heat, climate awareness, and other pieces as a purple topic. It's not red, it's not blue, because you are impacting everybody from the military, from police, emergency responders, to the unhoused, the homeless, the elderly, those in rural communities, urban communities, tribal members, the young. You're covering the gamut with this, and it could be everybody's mother, grandmother, grandfather, sister, son, or daughter who's at risk when it comes to the impacts of what we're seeing for climate and what we're seeing happening now with extreme heat. And I think some of the things that we're seeing within our state are unprecedented, because we saw our first dengue case that wasn't travel associated a year or two ago. And that's something that, as was mentioned, with vector-borne disease coming up further north and setting in with climate change, you have to be open to those conversations, and you have to be able to communicate as best as possible to those, to let them know that this isn't a certain gender, social group, or any type of just fixed impact. You have to see it as the whole community and state.
I just would like to add to that I think that health message is a really great way to reach people across the political spectrum. I mean, everyone can relate to impacts on their health and their children's health. And actually, the messaging around health impacts of climate change have been studied, and it's found that across all segments of the population, health messaging is trusted when it comes to climate impacts. And the other thing that I think is very hopeful is that climate solutions create immediate health and economic benefits in so many of our communities. We talk about built environment solutions, clean energy solutions. I think framing the benefits in terms of immediate health impacts, not 50 years from now, but right now. Some of these climate solutions that can create healthier built environments, healthier energy systems, and healthier economies. That kind of messaging, I think, resonates wherever you are and whoever you're speaking with. At least that's been our experience in Ohio and beyond.
Yeah, last year the New York Times had a fantastic story, a map of every zip code in Metro Los Angeles, showing the temperature difference, and you could really see that 2 zip codes away you could have a 5-degree average difference. And those tend to be lower income, and of course the more affluent places have more greenery and more trees. Hug trees all day long because they will save us ultimately. They absorb runoff water. Anyway, a million reasons. So what are some of the things you can do? Because I don't know when it's going to get cooler in Arizona, so.
Well, we're not putting all of our cards on one deck that it's going to get cooler in Arizona. I think we know that it's going to stay the same or get warmer as we move forward from heat season to heat season. So really what we're looking at is leveraging our governor's extreme heat preparedness plan that has both short-term and long-term recommendations, with really focusing in on energy, cooling centers, homelessness, looking at emergency response funding and other pieces that are priorities for our state, and how do we move forward showing gains within the short term and the long term as we take next steps within our state. We've really moved forward to look at engaging our state agencies along with community-based organizations, stakeholders, and partners across the state that have an interest in heat to give ownership and responsibility to any initiatives that we have within Arizona going forward, and be able to drive those needs, have a listening ear, and make sure that people are at the table, which is really important because we've had community-based movement when it comes to extreme heat in our state for more than 2 decades. So we don't want to reinvent the wheel, but what can we do to make that wheel spin better and be able to provide anything that's needed as they take some next steps? And so we're really looking at that transparency and collaborative approach across our state to get that engagement from community members.
Your title is Chief Heat Officer, but you also deal with cold?
Chief Heat Officer, we deal with, in public health, many hats for one position. So, we do deal, in my previous role, I was Assistant Director of Public Health Preparedness, so emergency response is part of that, and we did deal with cold. And I also have resilience, environment, and policy under me, so there is some cold oversight with that too.
Yeah, and I ask you that because Edmonton, Alberta in Canada had a week at -50 last winter. And Edmonton has never been the tropics, admittedly, but -40 was sort of cold. So minus 50, so we're getting the extremes at the other end too, and similar issues like how do you protect a population, and God forbid you have a power failure. And so since we have a room full of business people, how does this greater tendency towards having heat or even cold translate into problems for running businesses, and how can government help, and how do you see that translating?
I think from my perspective, we really need to look at a partnership going forward. I think I heard some interesting DEI conversations yesterday where we can agree to disagree, but we all are a community and trying to move forward on that end. So I think as the public looks at policy implementation through federal, state, and local agencies, we need the private sector at the table to make sure that any policy moving forward can be implemented. And is there any unforeseen impacts that we're not looking at to make sure that this can be a viable path moving forward, so that we can work in partnership to make sure that we're doing things in the right direction. I think we can also look at partnering on engaging the youth, who are very energetic when it comes to climate and heat. What can we do to support STEM students going forward to make sure that we have the social, environmental, and other scientists that we need to move forward? And then looking at leveraging technology such as AI and others for predictions, and to see where we can move forward and do models with community health lines such as energy, water, shelter, and others, that we can see what are those impacts to the community when they're going through these events, being hot or cold, and then also what do we need to bring them back to normal. And getting back to normalcy is such a huge piece for communities that we need to be aware of. As we can see, even just getting over the pandemic, many communities are not back to normal. So we're in a constant movement and flexibility within those communities, trying to get to normal daily life as much as possible. So I think there's often many partnering ways that we can look at and work together to make sure that we're moving forward appropriately.
I think I would just add too, we work a lot with the healthcare sector around climate resilience and sort of managing effects on buildings, operations, and staff around some of these issues. And I think some of the lessons from the healthcare sector apply equally to other private sector organizations as we think about planning for facility resilience for the next 50 years instead of just the past 50 years, thinking about impacts on our employees of some of these extreme weather events, and how are we planning for protecting the health of our employees, the well-being of our employees. If our employees are worried about the well-being of their family members, how does that affect how they show up in the workplace? Understanding that extreme weather, like extreme heat, can have impacts on mental and behavioral health. There are great data that interpersonal conflict and violence increase during heat waves. So just think, and also that learning, cognition, and behavior in school settings are affected by extreme heat, and that those effects can impact adults as well. So just as we think about planning for the resilience of our businesses, of our operations, thinking about prospective risk looking different than retrospective risk for our facilities, and thinking about the health of our employees and our communities in this larger context is important for the resilience of our businesses, healthcare and otherwise.
So I want to give people the opportunity to ask a question, and we have a mic runner who will come to you, but I'm going to ask a question now while we look for someone. COVID showed us the difficulty of reaching consensus, and let's be honest, of getting people willing to make sacrifice for their fellow citizens sometimes. And I'm appalled at how many people cough on you in the subway in New York right now, and you're just like, did we just go through that? I mean, that was gross before the pandemic. I don't know. Anyway, I mean, is it? There's going to be some tough work to do as a society as the climate crisis worsens. So, should we worry about people being able to make collective sacrifices?
I choose to take some really positive lessons from our experience in COVID, and I think as a primary care physician, there's a lot that we already know about how to compassionately message and meet people where they are, that honestly, we didn't all consistently do during COVID. There was so much divisiveness during that period. So I think that creating messaging that is relatable, that focuses on people's health, the health of their families, and focusing too on the benefits of climate solutions and giving people hope is so important. I think some of the doomsday messaging is very alienating for people. I think messaging that's based on fear or shame or divisiveness is very alienating for people. We know that in primary care clinical practice, and we can apply those sorts of principles to public health messaging. And I feel like we weren't, honestly, as a society, very consistent about doing that. We need to take ownership for that and learn from it, because I think that when we message in a way that's hope-based and personally relatable, that actually really works very well for people to come together. So that's my feeling.
No, I think really leaning on the hope and the positivity and the messaging is really key as we go forward. The doomsday, I would totally agree, does not work when doing public health messaging when it comes to any topic on that end. And I would also say, we've really done a push, and a lesson learned from COVID is about social connectivity, and push the message within our state to check on your family, your friends, and your neighbor to make sure that they're doing well in and outside of heat season, and making sure that they're getting the resources or connected to services as much as possible. And that comes with an awareness campaign for the public to know where to go for those resources and taking next steps. And we've leveraged partnerships such as with the American Red Cross in our state to do canvassing campaigns to get that message out, along with social media and other messaging, to really do a push for that. And I think that's a positive, empathetic approach that we can all do that has a very low burden, is just to get to know and check on your neighbors as we move forward.
So we have a question here.
Hello, Renee from United Talent Agency, and I'm very curious. My parents moved to outside of Phoenix a decade ago, so I've been able, when I go to visit from Los Angeles, we also share the Colorado River, which is a struggle for water for both our states. But I think about the energy consumption, because where they live, there are just massive warehouses being built, just for miles and miles. And I think about that record heat, day after day, over 100 degrees, the amount of air conditioning probably required for these facilities. And I'm just curious, what type of innovations is your state doing to, accommodate for that record heat and the need for cooling and, just the boom that the state is having? I'd love to hear the innovations.
Sure, I'll do my best on that one. I think, we try to make Arizona very business friendly. I think that's a priority for Governor Hobbs and her administration moving forward. But if you also look within the governor's extreme heat preparedness plan, grid resilience is a top priority for our state. I think we've seen some of the issues that can happen in several other areas and states that have had issues with their grids. And we've had monumental investment within our grids. We had our Governor Office of Resiliency put $13 million towards rural grid resiliency work, and then we've had additional funds come in over the past year to help support that. And I think we're really looking at that balancing act between the population and ensuring that grid resilience and making sure that we can accommodate the needs that happen within our state. And we started with structured and also organized rolling reliefs practices in case those are needed within our state, and using technology that we heard the other day, such as drones looking at power lines to see whether or not those are going to be at risk, and that we can go ahead and get those attended to before they become a problem within our state, and organizing efforts when it comes to wildfires too. So I think we're really having a comprehensive approach to make sure that we can deal with our residents and also with the businesses that we see coming into our state too.
And
So-
I
sorry, go ahead.
was just going to say, and with renewable energy, microgrids, and battery storage being a big part of that energy resilience solution, our office is highlighting examples of Inflation Reduction Act supported investments in healthcare, including some in Arizona. There's some wonderful examples of solar installations on health centers with battery storage, so that those facilities can serve as resilient sources of cooling for their community beyond also providing healthcare. So.
Yep.
So on that note, please join me in thanking our two panelists. And thank God it's almost the middle of October. The cool weather will come to Arizona soon, knock on wood. And so thank you for joining us. Appreciate it.